All right, 10 minutes after 7 now. A cancer diagnosis is upsetting at any age, but especially so when the patient is a child. It's natural to have many questions. Who should treat my child? Will my child get well? What does all of this mean for our family? Not all questions have answers, but here on the show this morning, we will try and give you the basic understandings, and we've got some statistics to also share with you. Roland will introduce our guest, who is right here with us.
We have the beautiful Dr. Lily Gloria Tego, and she is with the Child Health Department of the Korle Bu Teaching Hospital, Ghana's biggest hospital, premier hospital, we say. You enjoy your work, I can say.
Yeah.
Yeah. Childhood cancers. I was wondering, Mama, myself. I thought cancers were for old people.
Okay, so that's the common misperception that cancers only occur in the elderly, but it's not true. There are lots of children who develop cancer. Yeah.
So at what age would a child get cancer, for instance?
Okay, so cancer can develop at any age, right from birth till you die. So to explain that I'm going to explain what cancer is, and then that will probably help you understand why children can get cancer. So our body is made up of lots and lots of tiny cells that keep on dividing and multiplying as you grow. And these cells are tightly controlled such that they grow in a particular way. They multiply. If you are supposed to have 10 cells, then when they get to 10, it stops, and they are tightly controlled by genes. Then also when they get old or damaged, they are supposed to get destroyed. But when you have cancer, this normal process is disrupted. So you have cells that instead of multiplying to a limit, they just keep on growing and multiplying. Or cells that are dead or damaged that are supposed to be cleared off still persist and keep on growing. So if you look at a child who is persistently growing, you can understand why during the period of childhood, cancers can be common, because any little mistake that occurs during this process of growth can lead to a cancer. That's what happens. And some of these mistakes can even occur before birth, such that a child who is 1 month, 2 months can develop cancer.
Wow.
Yeah.
That makes it frightening, doesn't it?
Yeah, it does.
But usually, not before you come to Ghana, what type of cancers usually affect children around the world?
Okay. So there are various kinds. Basically, cancer can develop in any part of your body, but commonly we have the leukemias, which are cancers of the blood. We have the lymphomas. We have eye cancers in children. They are called retinoblastomas. We have kidney cancers called Wilms tumor. We have cancers in the muscle, rhabdomyosarcomas. You can have brain cancers. You can have bone cancers, liver cancers. Every part of the body can develop a cancer in it. Yeah.
Yes, but which ones do you most commonly find in Ghana?
Okay, so in Ghana we see the lymphomas more often, followed by the leukemias. Then we see a lot of the eye cancers as well, then followed by the kidney cancers. They are like our 4 topmost cancers that we see in children.
Is there a particular cause?
Okay, so for childhood cancers, little is known about the actual cause of it, because these genes, it's like there's a little mistake in the way the cells divide. It's difficult to pinpoint an actual cause for childhood cancers, but many things have been postulated, like some associations have been found between certain things and cancers. For example, radiation. It's known that if a mother was pregnant is exposed to radiation such as X-rays, it may predispose the child to having cancer. Or if you were born in a place where there's nuclear bombing going on, you can develop cancer.
But then you would argue that in this part of the world, there's nothing like that.
There's nothing like that in this part of the world. Yet we have children coming up with cancers. Some have postulated an association with some drugs, with chemicals like pesticides. Then others come and refute that association. Then also some viruses like hepatitis B, a virus known as Epstein-Barr virus. They've all been associated with cancer, but it's not that once you have Epstein-Barr you develop a cancer. So that's why.
So there's no direct link.
Yes. It's just an association.
We know the average income earnings of the average Ghanaian, and my mindset tells me cancers, because they are very peculiar, very expensive to treat. Is that the case?
Yeah.
And if that is the case, how does it make it difficult for the average Ghanaian to be able to take care of their children if they have such problems?
So cancer treatment is expensive wherever you go, especially so in our parts of the world. So for the treatment itself, like the drugs per se, you can have a treatment for a cancer going as much as 18,000 Ghana cedis. Some are relatively cheaper, 2,000 to 3,000 Ghana cedis. But even that, for the average Ghanaian, is a lot of money. And this for the treatment. Usually, the people come from all places in the country, from up north or from a village. They have to stop their farming and come with their child. So the cost doesn't even include that the fact that the other siblings may have to stop school because the parents have both moved to come and stay with their child in Kulebu. They are not working. So the cost goes way beyond the cost of even the treatment alone. Yeah.
But you know how we say when you're able to detect some of these things early, then you don't have to spend so much in curing.
Yeah.
So how can you do the detection?
Okay, so the good news about childhood cancers is that when detected early, as much as 75 to 85% of them can be cured, as compared to adult cancers where when you are given a diagnosis of cancer, you're like, going to die. But in our parts of the world, we are not getting that much success rates because many people are presenting very late. And that's our main issue. The reasons they present late are like a lot of reasons: financial, social, cultural, and others. But so to parents, there are a number of things you have to look out for in your child. So I'll go through a little acronym the South Africans developed called SILUAN, S-I-L-U-A-N. So S-I-L-U-A-N.
Okay.
Yeah. So S is to seek help for any persistent symptoms. So as a mother or a father, you know, any symptom that seems to persist and you can't seem to put your finger on, don't sit at home and think it will go on its own. Seek help. Then I is for the eye symptoms. So you can have a child with a white spot on the eye. That's how the eye cancers in children usually develop. I have a picture of it here. The first picture shows a child with a white spot.
Well, please hold it. We'll get our cameras to capture.
Okay. So when
and that's cancerous. That's a cancerous eye.
Yes, that's a cancerous eye. So that's how it begins. So if you don't report early at this stage, very soon the eye will start to bulge out, and then the whole eye gets destroyed. So you don't have to wait for the eye to bulge out. Once you see those white spots, many parents recognize it. They just don't seek help for it. Some will tell you that during the night, the child's eye is sort of shining like a cat because it's, yeah. And then, so if you see that, or if you have waited and now it's bulging, please report to the hospital. Or if a child suddenly can't see in that eye, you can report to the hospital. Or if the child develops a new squint, that's when the child seems to be looking elsewhere whilst looking at you, that the child didn't have before and suddenly develops it. It could be a sign of cancer, so please report. Now when you go to L, we are talking of lumps. Lumps in any part of the body, usually the neck, or it can be the abdomen or the jaw. You don't have to wait for it to become very huge. Once you see a little lump, please report to the hospital. Then the U is for unexplained fever, unexplained weight loss, or your child is easily getting fatigued or has become pale. You can see the palms are becoming white, the eye is white, or your child is bleeding. So some of our patients present with gum bleed and it ends up being a cancer, or even a nosebleed, or bleeding easily from cuts. Then the A is for aches. So if your child begins to complain of pain in the joints, in the limbs, in the back. And then N is for neurological symptoms. So if your child who has never had a convulsion suddenly out of the blue is having convulsions, or is complaining of persistent headache with or without vomiting, please report to the hospital. But as you can see, all these symptoms I've described can apply to many other illnesses. Yeah. So, and that's why you have to report early, because if you sit at home and say, oh, my child is complaining of pain, it's maybe rheumatism or something, as our mothers do, you never know what it may end up being. Yeah. So that's why you need to report.
But there's also the aspect about the facilities that can treat, and we know that your department is a specialized one. And so the mindset is that we're supposed to make sure we report early, and then we get early treatment. The first port of call for any person is a community hospital. And of course, we don't have that mindset of community hospitals in our country, but the nearest hospital you can find. And consistently, once you get better, you go back to the same facility. And so by the time you get to the main hospital like yours or the specialized hospital, it takes a lot of time.
Yeah, it does.
Can you be misdiagnosed?
Yeah.
Even from the hospital?
Yeah, there have been cases where people have gotten misdiagnosed. So that also brings to bear another way we can improve cancer diagnosis and treatment is by training those in the peripheral hospitals. Another reason they end up late with us is that when they go to the peripheral hospitals and they even do get diagnosed as cancer, and this person is probably up north, and then you're like, your child has this mass, it can't be treated here, so please go to Kolebu. The parents have probably never been to Accra. They have nowhere to stay when they come to Accra. They have no money, so they'll go back home to go and farm or sell or something to get more money. So they'll spend months at home before they finally arrive in Kolebu, even though the patient has been diagnosed well. So those are some of the challenges we're having.
Sure. Let me just say that if you've got questions on the childhood cancers conversation we're having now with Dr. Lily Tagoe, you can send us a message on 0560 800,000. That's the WhatsApp number, and then we'll put your questions across to her. But let's talk about statistics in Ghana. Do we have records?
Okay, so we don't actually have a cancer registry like they have elsewhere, but based on extrapolation from the incidence in other developed countries, that states that for children under the age of 15, each year 1 in 500 of them will get cancer. So when we extrapolate it to our Ghanaian population of above 20 million, we know that each year 1,000 children under the age of 15 in Ghana develop cancer. But
each year 1,000 children under the age of 15
will develop
cancer.
Yes, but we are not seeing all these in the hospital. So in Kolebu, for instance, we see about 180 new cases of childhood cancer each year. In Komfo-Anokye, they see slightly less, about 120 cases each year. So put together, we see about 300 cases. So that means that we have 700 we are not seeing. They are not.
Where do they go to?
Yeah. So they are probably either at home and have never reported, or have reported, have been misdiagnosed, or have been referred but haven't come or have died en route to
it
a
means
place.
That we don't have
know.
not all medical doctors are like you, right?
Well,
some of them perhaps have questionable competence.
Not really, but in most communities we don't even have doctors there, so yeah, their first point of call is not a doctor.
Sometimes you watch the televangelism programs, and you get to find that some of the growth that people have on their bodies are so gruesome, but they may have been there over time, but they could seem to be cancerous to the eye. Well, you have to test, but
yes.
What do you want to? So some of them.
So as I was saying, that when you come with the growth, we won't immediately assume you have. I mean, we can assume you have cancer, but that's not a definitive diagnosis. We have to do lots of tests to confirm the diagnosis. So you'd be taking through a number of blood tests, which the parents, most of them are expensive. So you do some blood tests, you do some imaging, you do an ultrasound, you may do a chest x-ray, you may do a CT scan of whatever parts, or even an MRI, which is a higher form of that scan. You can do bone scans. We can ask to take a bit of the growth to the lab for the pathologist to look at it under their slide and make the actual diagnosis. We can even take a bit of your marrow. So we do a number of tests to confirm.
You know, when Roland asks, where do the other people go? I was going to say some of them also go to the churches.
Yeah, some go to the churches, some go to the herbalists. So we have many children coming, and they come with scarification marks where herbalists have put herbs in for months, and the mass is just not decreasing in size, and they finally appear.
Now, so, Roland, just before you come in, how many of the cases are you able to treat comfortably?
Okay, so because of the late presentation, unfortunately about a third get to us and we can't do anything, because if you come when the cancer has already spread all across your body, because that's what cancers do, if left alone, they spread to your brain, to your lungs, everywhere, then we are not able to offer you curative treatment. We are able to give you palliative treatment where we make the child comfortable. And then about a third also, we start treatments, they get better, and the parents go home and like, oh, well, I came with the mass, it's gone, so why bother going back for more chemo? And they never show up. So in the end, we end up actually treating to completion only about 20 to 30% of the patients we actually see, as in the
even
180.
The average.
Okay.
Wow.
Yeah, which is
wow.
Now you've been talking about late reporting, etc. What is the stage of perhaps growth by the time you get the first infection, or by the time you start developing to the time where perhaps it's matures or saturates? If you get my question.
Talking of the cancer?
Yes.
Okay. So let me take, for example, the eye cancer. So at the time you see it as a white spot in the eye, it's like that's the early stages. Usually in other countries, because this eye cancer usually occurs in very little children, they have screenings. Sometimes they're even picked up as newborns, where they go to the doctor and then they shine a light into their eye and see which one is white and stuff like that. So if you are picked up like that at the screening, that's like really early. The cancer hasn't gone anywhere.
But do we have anything like that here?
No. I mean, if you do reports it's not like elsewhere, it's like a routine screen. Everybody knows to go to the doctor
but
and get it done.
But for us, the parents must pick up some of these things before it can be checked out.
Yes.
Okay.
So, for instance, at that stage, the cancer is only in the eye. But if you sit at home and you let it bulge out, then it's spreading and it can go into there's a nerve
that takes how many years? Or
well,
months?
It depends for each child. It's really not a set, but it takes months. Then it spreads through the optic nerve and then it goes to the brain, and then it spreads through the brain. At that point, we cannot offer you curative treatment. We can't say we can cure the cancer because now it's no longer in your eye, it's all over your brain. So that's what happens. But you can't say that, okay, when you see the eye in 2 months, it will go to your brain. So then you can come 1.5 months and we'll save you. You don't have that set.
Okay.
Yeah.
So I've got some comments on WhatsApp. Richard is watching in Kumasi. Richard says, good morning. Do we have some basic things we can do to prevent early childhood cancers?
Okay, that's difficult. Because for childhood cancers, unlike adults where you can say, okay, don't smoke and then you can get lung cancer, don't drink, then you can get liver cancer. As I said, it's difficult to prevent it because we don't really know what is causing it. But the prevention we can do here is more of secondary prevention, where you report early enough for the cancer to be treated. I think that's what we can do. Okay. I mean, apart from you avoiding x-rays during pregnancy and stuff like that, there's really little we can do.
Okay. So I've got this message. Akwesi in New Ebrim, since an early one, this was around 6, he says the government should reconsider building with health centers rather than chips, because the NHIS permit few or limited drugs to stock there. No pharmacy technician to control or give better info on drugs. Thanks. And then he comes back and says, what workshops do the GHS facilities or facilitate to detect early cases? Because when they come, we may always misdiagnose them. So by the time we realize the cancer had moved to second stage, Akwesi New Ebrim sounds like a doctor or a medical person. And then he says, how many stages of cancers do we have?
Okay. So, stages. So, most of the cancers have 4 stages. Like for each cancer, it has the stage. So, the stage is like the degree of spread. So, stage 1 is like it's limited to whatever organ or So if it's the kidney, stage 1 is nice and limited to the kidney. Stage 2 is sort of spread to the out borders of the kidney. Stage 3 is not only in the kidney, it's spread like in the abdomen. And stage 4 is when it goes to the lungs or elsewhere. So that's how the cancers are staged.
Okay. Yeah. Okay. This one says, what if the child has a cold or running ice and is tearing? See, I think that's the thing. Sometimes
It's okay. It's okay. None of such questions. She's not here to be given.
No. But Dr. Tego, you get it. I mean, that's like every parent's, especially when you're a mother, you are thinking a bit overboard, which is good.
Yeah.
Because then you take measures to prevent something that could occur sometime.
Yeah,
ideally, we're supposed to be taking measures, not that we will take. Maybe she will take measures because the average person needs to be informed before. That's the whole point. But you were mentioning, well, a child could get infected from birth or prior to delivery, etc. And even some of them to the time when they are as old as children. Are there certain lifestyles associated with some risky?
No. So for
so if you have a newborn, what can you say he shouldn't do?
Not necessarily newborn, because these days we tend to, if you're middle class or you have enough, you tend to make your children indulge in certain.
So not really, because even for those who get their cancers from hepatitis B, it's usually gotten at birth, and then the cancer develops as they grow. So if they get it like during teenage years because they are being promiscuous, they'll probably get the cancer in adulthood. So really, no.
Is that something that the parents, or particularly the mother, because the mother carries the pregnancy, is there something that the mother, apart from the x-rays, maybe some attitude of yours that can let the child get this?
You mean lifestyle?
Lifestyle, yes.
Yeah, so then again, aside the viruses like Hep B and HIV, for both of them, we can, if the mother has hepatitis B, we give the child an immunoglobulin at birth and a vaccine at birth so the child doesn't get it. So that's preventable. I think that can be a preventive measure. But then again, the proportion of childhood cancers from these viruses is like very small. For the majority of them, we just cannot pinpoint the cause.
Sure.
So usually when we tell parents, okay, we've done all these tests and your child has cancer, the first thing they ask is, what did I do wrong? What did I do wrong or something? But usually it's not really anything the parents did.
Okay. My last question. We live in a society where stigma is always a big issue, and I know that this is part of the whole effort to make sure you bring a lot more awareness to the public, and then that also ensures that there are early reporting of cases. The subject of stigma that usually is associated with our society due to our customs, traditions, our cultural practices, etc. How's that a big deal for you to deal with as medical people when it comes to childhood cancers?
Yeah, there is some stigma associated with childhood cancers, mainly because of lack of education. Because some people, when they go back to the community, they report that people think that the cancer is sort of contagious, so they don't allow their other children to come and play with their kids, which is sad because cancer is not contagious. So that stigma is there. And I asked one of my patients' mothers to send a letter of appeal for funds to her church or something. She's like, no, she doesn't want everyone to know her child has cancer. So that stigma is there, and it does impede our work.
You talk about money. Do we have a special fund to back parents who may not have the necessary?
So no, but we do have groups who support us. So ICGC, for one, has been our main supporter at Korle Bu. They've been supporting us with funds like monthly. And we have Well Child Cancer also supports us. Then we have other NGOs and groups that support us. But it's not like a fund that everyone can come and benefit from, because the money is limited compared to the number of children. So
how do you do it? You take care of, with some of these monies when they come in, do you take care of the very critical?
Yeah, so if people need like help critically and the parents can afford, we do use these funds to start off, but it's not possible to use the funds to treat the child for the entire treatment. But sometimes you have groups that come and say, okay, we want to sponsor 2 children's treatments or something like that. We even have individuals coming in and supporting.
You mentioned about success rates for the cases you see about 20-30. How many of them survive though? I mean, if you look at the 180 cases you may be dealing with annually.
So it's difficult to do the math now, but generally 20-30% of them get
cured. Let me just read the messages in wrapping up. Sefako says, good morning, Mama V and Roland. We're trying to solve this cancer issue, yet all the specialists are in Korle Bu. Why? This one says, is oncology parts of the curriculum for nursing training, since knowledge of it helps early detection? And it's from Honorable Wahab Cape, because this is a very relevant question.
Okay, let me start with the first. The first one. Unfortunately, right now, there are only 3 pediatric oncologists in the whole country. 2 in Korle Bu and 1 in Komfo Anokye. So it's not really like there are so many, and we've kept all of them in Korle Bu. There are only 3.
But would you know if is it oncology he asks, is it part of nursing training?
Well, I think so, because I did see one of their nurse trainers come to our ward.
Okay, all right. This one says, while shaving, I cut my, is this testes? Is it? With the razor, this cut just wouldn't go because the sore is always rubbing against my inner thigh. Is it cancer? Just like Kumar say, what? Okay, this one says, good morning. Can excess use of mobile phones by children cause cancer? That's from David. Don't answer that yet. Good morning, Roland Mama V. Please, my son has a very small white spot on the eye that I detected only last week. Can it be a cancer, Nelson and Kofoid? Yet? Not yet. I don't mean it's not cancer yet, too. I mean, the doctor shouldn't tackle it, yes. Mama V, we need a specialist or a pediatrician at least at every district level, so the referral can be quick if needed. That's from Gaddafi from Aplao. Okay, so that's the messages that we have. I want you to wrap up in answering these questions.
And then I wanted to add to obesity, child obesity. Has it got any relation?
No, that has been established.
Okay.
Wrap up for.
So somebody said they saw the spots last week.
I think they should report to the hospital immediately.
Is it a general, like a GP that he should go and see, or should go and see a pediatrician, or maybe chase after the few oncologists we have in the country?
GP,
The person should go to the hospital. Unfortunately, we don't have pediatricians in every hospital, but we all got trained in pediatrics during medical school. So
okay.
Yeah.
All right. Okay. How about the excessive? Somebody said excessive phone use by children.
So I've been seeing those things on the net, but they haven't been established as
medically.
Medically as a.
Okay.
Wow. At least for those of you who are buying mobile phone, it doesn't mean go.
But you shouldn't give. I mean, that child can speak once in a while. You can call daddy or mommy once in a while for the child to speak to them. But I don't think children should be using mobile phones.
Shouldn't be using mobile phones.
No, children should not be using mobile phones. All right, Doc. We appreciate your time here. Thank you so much for all the lessons, for all the tips on childhood cancers.
All right. So we have had in the studio Dr. Lily Gloria Tego. She's with the Child Health Unit or Department of the Korle Bu Teaching Hospital.
Yeah, Roland's new friend, by the way. But today is World Water Day. We've got lots of documentaries on water. We have a big conversation with the Deputy Water Resources, Works and Housing Minister, a man in charge of water, Samson Ahi, who will be here with us. But we've got this from our colleague, Latif, that we're going to share with you. Benis Abubedu also has got a piece, and it's interesting. You would love it. You know, sometimes the households have to share the bill or share the water as one source, and a lot of people have to feed into it. But how do they share the bill afterwards? And what happens when the tap is not flowing? All right here. We'll start with Latif's, and then Joseph Opoku Gakpo will join us here on the show.
He's the man we sent out there to go and do the rallying around, do a lot more of the running, and also do a lot more of the groundwork. We sent him to the north, the Volta region, and some of the farming communities around.
Okay, I didn't know about that.
Well, we're taking a break. When we come back, we have all these for you. We're setting the tone for our discussion for World Water Day.
All right.
Water supply has been a real challenge for residents in parts of the Greater Accra and the eastern regions of the country. The situation left most people with no option but to fall on untreated water for domestic use. Residents at Nsawam, for instance, resorted to the use of raw water from the Densu River. The story was no different at Pokuase and Amasaman in the Ga West district of the Greater Accra region. Joy News investigations revealed the shortage in most of the areas was partly caused by a blockade of a tributary by Sandwinners at Mensa Krom in the eastern region. The water company quickly moved in to ensure the blockade was removed and the perpetrators dealt with. Few days after the expose and the subsequent removal of the blockade on the Kuya River, water supply seems to have improved.
Yeah.
And where you buy from, are you sure it is potable? Is it clean?
At times it's not clean, but we manage it.
Where is it coming from?
We don't know. Some are from Kwabenya. Kwabenya. They say it's a plant there.
Yeah, my tanker no,
We do not have real challenge with water here. We rely on the water tanker operators.
We are 1.3 old cities. And I say 1.5 old cities. They are very.
Okay. Actually, we the one who collected. I don't know whether if it is good or not because we asked them to bring it. So whether if they have treated it or not, we don't know.
But you drink it?
Yes, of course.
Wow. In the wake of the shortage, residents of Amanfrom, also in the Ga West district, relied on tanker operators for water. Even though there is seeming consistency in supply, some residents, ignorant of the improvement in supply, still rely on the tanker operators. Yahya leads a team of water tanker operators who fetch water from River Nsunkwa here at Pokuase.
This is what we drink. It is this same water we sell to residents of Pokuase and Amasaman.
Connection be other side. Why any that connection and
the connection was done by an NGO.
To prevent the outbreak of waterborne diseases, an NGO, Safe Water Network, intervened by setting up this treatment plant where water from Nsunkwa, which literally means river of life, is treated and sold to residents of Pokuase and neighboring communities.
Filter cartridges, we have filters inside. Yeah. So where the water can pass through this cartridge, and what happens here? What happens to the water? We transfer to have treated tank So what do you have in here? Treated water.
But like Oliver Twist, despite the fact that supply in this area has partly been restored, residents still expect the water company to do more to ensure continual flow of potable water.